Go.
Good morning and welcome to the Vector Awareness Week press launch for 2021. I am your host, Glenda Sipal. Vector Awareness Week has been observed for nearly 10 years now by the Department of Health and Wellness to create awareness for vectors and vector-borne diseases and to also engage the public in exercises to reduce the presence of vectors in and around your home. On our panel this morning, we have the Permanent Secretary in the Department of Health and Wellness, Mr. Benson Emil, the Assistant Chief Environmental Health Officer, Mrs. Cheryl St. Romain, and the Medical Officer of Health, Dr. Glenn Joseph. Good morning and welcome.
Good morning.
This live broadcast is on the Government of St. Lucia's YouTube and Facebook pages and also on NTN. I now invite our PS to address us.
Thank you, Madam Moderator. Good morning, colleagues. Good morning, St. Lucia. The Department of Health and Wellness would like to welcome you to be part of Vector Awareness Week. The COVID-19 pandemic has created many challenges, not only for the Department of Health and Wellness, but also the people of St. Lucia. While COVID continues to affect our people, vector-borne diseases like dengue fever remain endemic in the country, putting a strain on the economy and people. According to the World Health Organization, vector-borne diseases account for more than 17% of all infectious diseases, causing more than 700,000 deaths annually. Dengue is the most prevalent viral infection transmitted by Aedes mosquitoes. More than 3.9 billion people in over 129 countries are at risk of contracting dengue, with an estimated 96 million symptomatic cases and an estimated 40,000 deaths every year. The burden of disease like dengue fever is highest in tropical and subtropical regions, and they disproportionately affect the poorest demographic. Since 2011, major outbreaks of dengue fever and leptospirosis have affected our population and also claimed their lives. These illnesses cause chronic suffering, long life, morbidity, disability, and occasional stigmatization of the victims. Distribution of vector-borne diseases is determined by a complex set of demographics, environmental and social factors. Vector-borne diseases does not discriminate. It affects people of all races, ages, and income levels, and it is because of this we must raise awareness of the diseases, its symptoms, so we can more easily identify it and more effectively manage it. This week, and leading into the rest of the year, as we observe Vector Awareness Week, let us equip ourselves with the knowledge, tools, and resources available to fight in the battle against vector-borne diseases. This year's campaign is planned to take a virtual approach and will engage many stakeholders. The Department of Health and Wellness is committed to advancing surveillance and reporting systems to better prevent, diagnose, and treat vector-borne diseases. Strides have been taken to enhance the capacity of our officers in the area of entomological surveillance, case management, data, and research in order to better tailor approaches and treatments to vector and patient responsibility. I stand before you, together with my colleagues, endorsing Vector Awareness Week, which will run from June 7th to June 13th. I encourage citizens, government agencies, private businesses, non-profit organizations, and all other interested groups to engage in activities that will increase awareness in an effort to take control of their communities. As we endeavor to reduce the incidence on morbidity and mortality caused by this vector-borne disease. Thank you.
Thank you, PS. Now, Dr. Joseph will give us a situational analysis of vector management in St. Lucia.
Thank you, Madam Host. Thank you, PS, for leading us into the activities as it relates to the Vector Awareness Week. You have pointed out, PS, some very pertinent facts as it relates to vector and vector-borne diseases globally. And I must say at this point that in St. Lucia, we have seen the impact of vector-borne diseases over the years. Mosquitoes like the Aedes species, which is prevalent in St. Lucia, transmits dengue, chikungunya, Zika, and yellow fever. We have also experienced the impact of leptospirosis, which is transmitted mainly by rodents. As pointed out earlier by PS, we have recognized the World Health Organization would have noticed some 30-fold increase in the incidence of dengue over the past 50 years, with some 400 million infections and over 100 million symptomatic cases occurring every year in over some 129 countries. In addition, hundreds of thousands of severe cases occur each year with over 40,000 deaths. Dengue is an acute febrile illness caused by one of 4 types of dengue viruses. And as a result, once you're infected, you still have the opportunity to be infected with dengue up to 4 times in your lifetime. What we have seen is that 25% of the infected persons tend to develop either a mild through the severe form of the illness. And 1 in 20, about 5% of the infected cases are likely to become severe. In St. Lucia, we have experienced our largest dengue outbreak on record in 2020, with some 1,306 confirmed cases. The cases were distributed across the island of St. Lucia, with the greatest incidence occurring in the north of the island. The greatest number of cases, which account for some 33%, occurred in the month of September, which was followed in October with 28% of the cases. The cases were approximately equally distributed between male and females, with male accounting for just a marginal 51% of the cases. We would have seen that dengue has no respect for age group, as persons as young as 3 weeks to as old as 94 years were impacted during the 2020 outbreak. Those persons 5 to 14 years accounted for the greatest proportion of cases with 33%. During 2020, we have seen 20% of the cases being hospitalized, with the greatest hospitalization occurring in those 5 to 14 years of age. We did see significant number of persons within the 15 to 24 years and the 25 to 49 years age group being hospitalized too at 21%. Sadly, we have had 3 dengue or dengue-related deaths. So far, for 2021, the Department of Health and Wellness confirmed 14 cases of dengue, 10 of which occurred within the first 5 weeks of this year, with the last 3 5 weeks interval occurring for 1 to 2 of the cases. Of these, 68% were male, 21% were hospitalized, no fatalities have been recorded thus far. As mentioned earlier, mosquitoes do transmit other illnesses. And we have seen for this year 1 case of chikungunya occurring in March. Also, we have noticed 1 case of leptospirosis so far for this year. Presently, we are in the current 2021 Atlantic hurricane season and the wet season. And this would generally promote the vector breeding grounds. And as such, as citizens, residents of St. Lucia, we must do all it takes to manage these vectors, preventing their breeding, and in so doing, stop the next outbreak of vector-borne diseases. At this time, I hand you over to our host. Thank you.
Thank you, Dr. Joseph. Mr. St. Romain will give us an overview of what the Vector Awareness Campaign for 2021 entails.
Thank you, Madam Host. Good morning to PS and Dr. Joseph. Good morning to persons in the virtual land or world, rather. I begin by welcoming everyone to this auspicious occasion commemorating our annual Vector Awareness Week. Vector Awareness Week has been a staple in the calendar of activities of the Department of Health and Wellness, with the intention to raise awareness of vector and vector-borne diseases, together with the challenges faced by the health team when managing vector-borne diseases in St. Lucia. Vector Awareness Week is launched annually prior to the commencement of the rainy season in an effort to remind the public about the potential risk associated with the rainy season and vectors, and also to transform their thinking as it relates to vector management in the home. The theme for this year is Act Now, Know How, Vectors, Live, Breed, Feed. This theme encompasses our mission, which is to promote and protect health in the country. Last year, the Department of Health and Wellness experienced the worst outbreak of dengue fever. A total of 1,306 cases were confirmed, and an unfortunate 3 deaths were recorded by the end of 2020. 1 death is 1 too many, and this is why it is necessary that everyone work together to reduce the incidence of vector-borne diseases in the country. It is very clear that the government of St. Lucia cannot do this alone. The people of St. Lucia should play a vital role in keeping vectors at bay. Hence, we remain true to our tradition. Of Vector Awareness Week, which is to provide the necessary information to to empower people to take action to protect their health and reduce the presence of vectors in their homes and, by extension, their communities. Prior to the COVID-19 pandemic outbreak, Vector Awareness Week was primarily dependent on community-based activities which involved cleanup campaigns, hands-on training, and face-to-face meetings and education sessions. However, with COVID-19 restrictions and established protocols, this has hindered our approach, which necessitated this change. The Department of Health and Wellness is not deterred and remains committed to the objective of reaching the masses, and our approach this year will be for the most part virtual, which takes in the airing of public service announcements, development of television productions, and dissemination of media cards, which will be the highlight of the week. Vector control officers on the ground will be intensifying surveillance activities and conducting fogging operations to control the Aedes aegypti mosquito, while our baiting program will continue concurrently. The week will be observed June 7 to June 13, 2021. However, activities will continue throughout the year. Every year, the Department of Health and Wellness collaborates with important stakeholders with a shared vision as we leverage their skills and knowledge in the fight against vectors and vector-borne diseases. This year, the Department of Health and Wellness collaborated with external agencies in the name of St. Lucia Solid Waste Management Authority, FDL Pest Control Solutions, and the Ministry of Social Transformation, along with its internal units, namely the Bureau of Health Education, Epidemiology Unit, and Nursing Division. I take this opportunity to thank all who were and continue to be involved in making this event possible. During the rainy season, it is very likely to see an increase in breeding grounds for both mosquitoes and rats. So we implore the people of St. Lucia to be mindful of their surroundings and become part of the fight against vectors in St. Lucia by conducting weekly inspections of your property so that we may enjoy a healthy people and healthy environment. In observance of this year's event, I challenge you to take control and take back your home. Prevent vectors from spreading illnesses and sharing your home. Imagine the impact that you will have if you prevent one female mosquito able to produce nearly 300 eggs in her short lifetime, and one rat producing nearly 56 offsprings in her lifetime. Consider this. I thank you.
Thank you, Mrs. St. Romain. I now welcome questions from our viewers. The number is on the screen. If you have any questions, feel free to WhatsApp the number on the screen so anybody on our panel can answer. The number on the screen, 286-8772. As we wait for questions, anything further to add, PS? Any last remarks?
Just to add to our Deputy Environmental Officer's comment that, as St. Lucians, we have a big role to play in our defense against, these diseases. Our very environment, our households, they are the breeding ground for the carriers of those diseases. And if we take responsibility to assist in eradicating both the rodents and mosquitoes, we will be contributing to the defense and response of St. Lucia. And in doing so, we'll be preserving, our lives and the lives of persons around us.
Thank you, PS. So if we have no questions from our viewers, I would like to take this opportunity to thank Mr. Emil, Mr. St. Romain, and Dr. Joseph for sharing this information with us today. Thank you to our viewing public. We ask that you join the Department of Health and Wellness and be part of this Vector Awareness Campaign 2021 by engaging in an activity to reduce vectors and share the information with your friends and family to ensure that the message reaches as many people as possible. On behalf of the entire production team at NTN GIS, I am your host, Glenda Sipal, saying thanks for watching. Until next time.